afternoon again, and welcome here to Series 5 in the Text Protects Connects Zoom Lunch and Learn series. Today's episode, we're going to talk about community resilience and being trauma-informed. My name is Jennifer Lucy, and I'm the Managing Director of Programs for Text Protects. For those of you who might be new to us today, thank you for joining us. And Text protects Texas children from the trauma of abuse and neglect and empowers families to thrive. And we do that through education, research, and advocacy. We're also the Prevent Child Abuse America chapter here in Texas. So in addition to working on prevention and child protection issues, Text Protects works to ensure that survivors of childhood adversity have access to behavioral health services and trauma-informed systems to promote their health and well-being. Today's webinar is going to guide us through the basics of how we can build community resilience with trauma-informed care. And so this includes understanding the prevalence and biological mechanisms of trauma, but also understanding effective strategies and the organizational competencies and questions that can ensure our services and our systems are healing for our employees, for our clients, for our community. And to introduce us to these topics, I'm thrilled to introduce our presenter today, Ana Valdez from Fostering Hope. After a diverse set of jobs, including teaching high school, coordinating program and providing care to teenage girls in Monterrey, Mexico, and other interesting work, Ana is now the Director of Programs for Fostering Hope, Austin. And in that role, she trains families and other caregivers, including professional staff, in trauma-informed care. She develops audience-specific curriculum and coordinates trauma-informed efforts for organizations. Her experience includes developing trainings for volunteers, for churches, leading support groups for foster parents and caregivers, and helping institutions move through this continuum of trauma-informed care organizationally. She served the caregivers of vulnerable children for over 8 years, helping them gain skills to love their children well. And she's certified as a TBRI, which is Trust-Based Relational Intervention Practitioner, and a Trauma Competent Caregiver Affiliate Trainer. So we are so grateful to have her with us today to share her expertise in this area and to share with us a little bit about the great work of Fostering Hope. So with that, I'm going to turn it over to Ana. Welcome.
Thank you, Jennifer. Wow, that was so kind. Thank you for that great introduction. Yes, I'm Ana and I'm with Fostering Hope, and we are a nonprofit here in Austin that serves foster and adoptive families. That is our primary audience. And we do three things to really do our work within the foster care and adoptive system. Is one, we engage people. We engage the community to find where they fit in the foster care system. Not everybody can be a foster parent, but everybody can do something. We also do a lot of education. We educate the caregivers of children who are vulnerable, but also anyone who cares for them, like teachers and other child welfare professionals. And lastly, we innovate. We're involved in innovative projects. We are currently involved in one with the Williamson County Courts, where we're looking on how to provide intensive services to the parents that are involved in the foster care system. So that is a little bit about us. If you want to know more, you can always visit our website at fosteringhope.org, fosteringhopeaustin.org. But I wanted to go ahead and get started, and I don't know how much you all know about trauma-informed care, and maybe you can, if you wanted to just in the chat box tell us a little bit, like, I know a lot, I don't know very much, so you can share with the participants here how much you know. But when I started this work, I started in an orphanage. I started about 8 years ago. I didn't know anything about trauma-informed care. And here's a funny story of how much I did not know. I started off as a caregiver, and the first night I met the 10 girls that I was going to live with and care for and raise. And one of the first questions they asked me was, "Do you like egg?" And I was like, no, I don't like egg. I try to eat plant-based, I try to eat healthy. That's not really something I like. And they all started laughing. All 10 of them were laughing at me. I did not know why they were laughing. And I did not know that every night at the orphanage, we ate egg for dinner. And I love that story because that's really a picture of what my life was for the next 5 years with them. Just a big learning curve. I was previously a teacher and I thought, you know what, I could do this job. I have tools, I have education. Things had worked for me before in the classroom with a different type of student. And I thought that it was going to be exactly the same. And boy, was I wrong. But that was where my questions started as I started serving people who had experienced trauma. So let's get started by first saying that we have to switch our lenses. People that have experienced trauma, and those of you in the education fields like we saw, or the nonprofit sector that have programs for probably the most vulnerable people in our community, we have to switch our lenses of how we see them. I definitely had to do that with my girls. I started off seeing them as a typical high school student. I had 10 teenage girls, and I had to change the way I saw them. There was behaviors I didn't understand. There was reactions I didn't understand. There were some of their histories and stories that I didn't understand how they impacted them. So this is our primary goal here in the hour that we'll be together, is to take off the lenses we have now in the way that we view maybe our most difficult case, our most difficult person that we serve. And in this hour, I would love for us to put on a different pair of lenses. So think about how you view them now. Maybe you view them as they just don't want to succeed. They just don't want to get better. I already tried, because that's the way I used to view them. And at the end, after we learn a little bit about trauma and resilience, I'm going to ask you, how have your lenses changed? So keep that in mind as we're going through this. Okay, so first things first, let's just talk about the elephant in the room. There are people that we serve, children and families in our community that have been impacted by trauma. The people that we advocate for have been impacted by trauma. The people in our programs, in our educational system, they have been impacted by trauma. And what we want for them, what we want for the most vulnerable in our community, is really the resilience, the ability to recover when faced with this adversity, hard things, right? This adversity in their life. The good news is, and I usually end with the good news, but today I'm going to start with the good news. The good news is that our brain is plastic and our body wants to heal. So I want to start off by saying what you do for those that you serve that have experienced trauma, and anyone really, is so impactful and so important, even to their brain structure, to how they are healing and growing and maturing. And that's really the hope here. And I hope you can see as we go along how important you are in their healing process. I don't know if Jennifer or Lucy mentioned this, but if you have a question, we'll have a little bit of time for question and answers at the end. Pop them into the Q&A box, because that's where we'll be looking at to answer your questions. Just wanted to point that out. All right, so why do we need trauma-informed care? I think especially if we're in advocacy and even in the school system now, we're hearing a lot about trauma-informed care, and there are a lot of big opinions, right? Some people for it, some people against it, but why is this important? First is to realize how trauma impacts child development. So even if you work with adults now, what happened in their past is definitely impacting their present. And many times, if you work with adults, that is why they need someone to advocate for them. That is why they need of your services and your programs, right? Second, is to gain tools to respond in a way that is safe for them, right? I'm sure we have great programs, and every time I meet someone and hear about the great work they're doing, there's great programs. But our big question today is, are our programs safe enough for people who have experienced trauma in our community? Are they the safest that they can be? And we'll be looking more at that. And the third one is to resist re-traumatization. The last thing we want is for someone to come to our programs, to our schools, someone that we're advocating for, to come to us, and then in our way of trying to help them, we actually do more harm, right? So this is the reason why we need trauma-informed practices in every institution and organization in our community. So we're going to be looking, and I'm going to encourage you to look at, as I'm talking and about trauma, look at the children you serve, look at the adults or the families that you serve, and also here's kind of a new one that not many people are talking about yet, but look at your team. In your institution, your facility, your organization, do we have practices and processes that are trauma-informed for the people that work with us, right? The people that work for us, for our team. So we're going to be looking at these three different categories. Okay, so let me prove to you that the people you serve and the people you advocate for have experienced trauma. If you haven't heard about this survey, the Adverse Childhood Experiences Study, it was done quite a while ago by CDC and Kaiser Permanente, and there's been multiple studies done after that. This was done in the 80s. And it shows that about 64% of Americans have experienced at least one adverse childhood experience. So most of us, the majority of Americans, the majority of the people that you serve in your nonprofit, in your education facility, have experienced something traumatic in their life. And that could be, this survey talks about or looks at 10 childhood traumas. It's 5 personal, like how did they feel in their family? Did they feel loved? Did they feel accepted? Did they lose anybody close to them? As well as 5 relating to their family members. Did they have anyone in their family that maybe was an alcoholic or was in prison? So if you think about it, that's a big number of the people that we serve, the people that come into our programs, the people that come into our schools, the kids or adults, that's 64% of them have experienced at least one traumatic experience in their life. And why is this important? Only 36% of us have 0 of these traumatic experiences, and you'll see how many of us have 1, how many have 2, 3, and 4. And this is really important because it predicts what happens to them in adulthood, even their health. It predicts the kind of help they're going to need in adulthood. So if we have programs, if we have educational policies, and if we have services for the most vulnerable in our society, they're going to come to us because they've experienced something like this, right? An adverse childhood experience. So I'm going to give you just a little bit of what this type of toxic stress does. It damages the function and structure of a kid's developing brain. So those of you that come from the educational system here today, think about all these great lesson plans that maybe you have for the children in your classroom or the children in your school, all the great things you want to do throughout the school year. But 64% of them might have some damage in their brain. So what that means is we need to change how we're teaching them. We need to change how our schools are operating, right? Because we have to keep that in mind. It affects short-term health, it affects long-term health, such as adult onset of diabetes, cancer, autoimmune disease. And here's here is the stat that kind of shocks me. For these folks that have experienced 4 or more ACEs, they're 7 times more likely to be an alcoholic and 1,200% more likely to attempt suicide. So you can see how these traumatic experiences lead to health and even mental health problems, right? So keep this in mind as you're thinking, you know, does my institution really need trauma-informed care? Does my school really need something like this? The short answer is yes. People that you serve have experienced trauma. Okay, so what are some of those risk factors that put someone at risk for developing these emotional and behavioral issues, right? And the reason why we need trauma-informed care. Here are the 6 risk factors stemming from difficult pregnancy. What happened to mom while she was pregnant with this with a baby? Was mom stressed? Was mom depressed? Was mom using drugs or alcohol? That already begins to impact the function and development of the child's brain while in utero. Also difficult birth, right? Access to healthcare even, anything like that. Early hospitalization or separation. We can see this in maybe kids that were born prematurely and had to be in an incubator for a period of time where nobody could touch them or talk to them. That already begins to impact their brain function. And then of course we have the harder ones that we usually hear about the most, right? We have abuse, neglect, and trauma. And here's the thing, neglect is so impactful on a child's developing brain. Neglect gives the message to your brain, you don't exist. And abuse gives the message to your brain, I don't like you. And the reason why you don't exist is so hard on our childhood brain is because as a child, we all need another brain in order to develop. A brain cannot develop on its own. So we all need that healthy, secure caregiver to lead us in development. So if there is no one interacting with our brain, right, if we don't have that emotional care, if we don't have what we need physically as far as nutrition and health care, that already impacts and sets us on a risk for developing emotional and behavioral issues. And then here we have trauma, right? And here it's talking about a one-time event. Maybe something that happened because of a natural disaster, maybe a death that was witnessed, any one of those ACE scores that we talked about previously. So if we have anyone in the people that we serve that have experienced these risk factors, they're going to need trauma-informed care. They're going to need us to think about how we're offering services and programs to them in our community in order to lead them to resilience and healing. So let's talk a little bit more about trauma. We mentioned that trauma could be a one-time response or a one-time event, but I want to look at trauma more as the response that your body has to that event. So I cannot tell you exactly what event is traumatic. Everyone will interpret events differently. But what we want to look at more is how did the body respond to that event, right? To an overwhelming situation even. So I'll give you a quick little example of my own life. A few years ago, I was involved in an accident where I fell down a flight of stairs. And at the bottom of the stairs, there was a big brick, you know, those big gray blocked bricks. And I hit my head on that brick and I cut my head open, and it was a very bad experience. Had to go to the hospital, get sewn up, that kind of thing. But after I was recovered, at least my health was, I had to go back home. And guess where I lived? I lived on top of those stairs. I had to climb those stairs to get to my apartment. And I remember the first time, a couple of weeks after that, I had to go back to my apartment. I already knew about trauma. I was already training this. I had a lot of tools in my tool belt to be able to deal with this. But I stood at the bottom of the stairs and I kind of talked to myself and I said, you're okay. You're safe. You're not going to fall again. Everything's going to be fine. Hold on to the rail. And I could feel my heart beating so fast. I could feel my breath getting faster and more shallow. It was almost as if I had run a mile and I hadn't even started climbing those stairs. I got to the top and it was so emotional when I got to the top. And it was hard to go up those stairs maybe for a month or 2 or 3 after my accident. And I just want you to imagine, it was hard for me to go up any stairs, but I want you to imagine that you are trying to give me an instruction and you tell me, come up these stairs, I have something to do for you, this is where we do things, this is what we're gonna do. And I stop at the bottom of the stairs and I'm trying to convince myself that I am safe. And you turn around and you look at me and you're probably thinking, why do you always do that? Why can't you just listen? Why don't you want to succeed? Why don't you follow my instructions? I always have to repeat myself with you. What you wouldn't know is that the stairs at that time, any stairs, were not safe to me. The stairs did not mean the same thing, and they probably never will mean the same thing that they do to you and they do to me. For me, the stairs are unsafe. They're dangerous. And for you, they're safe. You climb them every day. You get through it every day. And that's really what trauma is, right? It's the body's response. So we have people in our education system, youth that we're advocating for, adults in our programs, in our facilities, in our institutions that have experienced adverse childhood experiences, have experienced relational trauma between the people that they love have hurt them, and they are impacted in their brain, in their body, in their biology, and their behavior. So when we're advocating for them, when we're building programs in schools and classrooms for them, we have to keep that in mind. When we're looking at their behavior and maybe we're frustrated by it, or we don't understand why they're still stuck in the same situation, like I was at the bottom of the stairs many times, we have to ask ourselves, what is the meaning behind this behavior? Where is this coming from, right? And understand that this could be a trauma response from their body. Trauma impacts the brain, and I'm not going to go too deep into this. I could nerd out and we could talk about parts of the brain, but we don't have very long here, y'all. So trauma gets us stuck in our fear brain. When I was at the bottom of the stairs, you could have been talking to me, giving me instructions, telling me about your wonderful program and nonprofit or school, but I am stuck down here and I am not listening. I am trying to get through climbing these stairs, because this bottom part of our brain that we see right there, it continually asks, am I safe? Am I safe? Am I safe? And that's what I want to focus on. It makes us turn off our executive functioning, our prefrontal cortex, the part that asks, what can I learn? And isn't that what we want kids to ask when they come into our schools, or the adults to ask when they come into our nonprofit programs? I work with a lot of parents and I always want them to be ready to learn. But first, they have to feel safe. This has to be relaxed. They have to feel safe in order for their learning brain to even turn on, right? So that is what we're going to be focusing on. How do we make people feel safe so that we can lead them closer to healing, closer to resilience? right? Because fear is a bully. It shuts off their cortex. It causes them to use their protective strategies that they've developed to kind of operate, right? Like manipulation and control, triangulation, those strategies that have really helped them this far in life. And it positions them to fight, to flee, or to freeze, right? When a person doesn't feel safe, right? Let's say they walk into our schools or our program, and we're not set up to create a safe environment for them, taking into account their history, taking into account their experience. This front part of the brain that we want, the executive functioning, is going to be off. Whatever it is that you want to help them do, you want to help them plan for their future, you want to help them learn math, all that is off. And this is on bright red, and they are looking, do I have to flee? Do I have to freeze? Do I have to fight? What do I have to do in order to survive, right? Because many times they haven't felt safe, and their brain is so used to going there quickly, right? So number one, we want to make them feel safe in order to make their brain come back online, right? In order to make their brain heal and grow and mature, because it's possible. We saw that at the beginning. It's possible for that to happen. But first, they have to feel safe. It also makes them unable to discern the needs of others, especially if we're thinking about the work environment, like our team, trying to work in a team. We can only work in a team and help each other out if we feel safe. A family can only look out for each other. A father, a mother can only make good decisions for their children if they feel safe, if they're relaxed from their fear brain and their executive functioning brain is on. That is the only way they're able to make good decisions. I think that's really important for us, right, to understand, because I don't know about you, but I've looked at behavior sometimes and been like, what made you do that? You knew better. You know what a good decision is. Why did you act that way? Why did you make that decision? And I think when we understand what part of the brain was functioning and driving them, that'll help us see the meaning behind their behavior. Okay, so here we go. Let's look at the more practical part a little bit. Here are the goals of trauma-informed care. And as I'm explaining this, I'm going to go quickly through this again, but think about an environment that your client is in when they come to you, whether that's the school environment, if you have students, if you're in a leadership position, think about your team. If you're in an advocacy position, think about whatever it is that you're fighting for them. What environment in the nonprofit world, in our programs, what environment are we setting when people walk into our lobby or when they join one of our programs, right? Is there safety? And here's the thing with safety, because I remember thinking for my girls, right? And I would lock the door at night and they still did not feel safe. I remember thinking, like, the door's locked, right? I know they're safe. No one is going to come here. But there is a difference in knowing someone is safe and that person feeling safe, right? So when someone feels safe, when there's felt safety, we're going to have their fear brain relax and their executive functioning brain is going to be on. And that's really what we want, right? 2, choice. Is there a choice, a place where our client, whether that's the student, the adult, the family, whoever that is, where they have a voice in the matter, right? Is there different paths for them to take to get to the place that we want them to get to? Whenever we give someone a choice, even if it's a child, and we're trying to get them to cooperate with us, and we say, hey, bud, you can either do this or you can do that. And they get to choose. Their brain feels like they have a little bit of control, and they're more likely to cooperate with us. So that's why choice is so important. The third one is collaborative, right? Collaboration. When we're building programs for those who have experienced trauma and come from maybe a high ACE score, are we involving them in our collaboration? Are we involving them in the process of planning this? Are we listening to their experience with the system, with our system? Are we listening to what they have to say about it, their story about it? 4 is trustworthiness. When they come to us to be educated by us, to participate in our services, do they trust us? Or is their fear brain on? Have we built enough of a connection to have that trust from our client or the family or the individual we serve, even in our team, right? Is there a trust if you're in a leadership position? Is there a trust from your team? And then last one, empowerment. Does your client, does the student, do they have what they need in order to succeed? And this starts from the bottom of like the physical needs, like do they have enough to eat? Do they have enough to drink? I'm thinking about even now that we're doing a lot of online learning for students, do they have what they need at home, like an internet connection, a space to learn, the right environment? For adults and families, do they have their basic needs met in order to participate adequately in our programs, right? So these are the things that we need to be looking at to be trauma informed. So here's the one I'm going to focus on today because unfortunately I would love to dive deep on each one of those with you, but we don't have time. So I really wanted to focus on today on being safe, because the first step in building a trauma-informed culture or organization or facility or school, the first one is that the person, whoever that is, your client, feels physically and emotionally safe. Okay, those are two different things. Physically, that's when we lock the doors, right? That's when we have adequate light. That's when, you know, they feel physically safe. But how do they feel emotionally? Are there things that we are doing, that our team is doing? Are there things that we've changed in the space to help them feel emotionally safe? Okay, so here are some things I would like you to consider, some questions. Yeah, the questions are coming up next. Let's look at this really quick. If we want to be trauma informed, we need to have awareness of trauma, which is why you're here today, right? Now you know 64% of Americans have experienced something traumatic in their lives. We need to know the signs and symptoms of trauma, which is what we talked about, right? Where your body responds. Whatever you feel like when you're stressed, right? I'm sure every participant has felt stressed before, but those are also the signs of trauma. Those are the signs that you don't feel safe, right? Going back to my example at the bottom of the stairs, you tense up. Maybe you get moody. Maybe all of a sudden your heart starts beating faster. Your brain tells you something's not right, something's not safe. That will happen to our clients, right? When they don't feel safe. And then this is where we're at. We're trying to look at integrating appropriate trauma responses into what we do every day with the people that we serve. And then that is all to avoid re-traumatization. So let's look at these 5 questions that I would like you to consider. And we are going to send you a PDF that dive a little bit deeper into these 5 questions. And if I were to dream up the ideal world in my head for you all, it would be so great if you would talk about these things with your team. for 15 minutes, for 20 minutes. Let's talk about these questions. Does the child or our client have their physical needs met? When they come to us, when was the last time they ate? When they come to us, did they take a 2-hour bus ride to get here and now they need, to go to the bathroom first, or they need to drink water first? Do they have their physical needs met before we get started with our program or our education? Are we making them feel safe? And this is everything from how we set up the room, right? But also us. What are we bringing to this? How is my voice that time when I talk to them? Was I towering over them and pointing over them at that time? That automatically does not make someone feel safe, right? Was I looking them in the eyes when I was explaining something to them? Did I have the right translation of something? Did I have a translator present when that was needed? Things that we do to make them feel safe. Was I talking too fast? Was my voice too deep and it sounded more like a command than an instruction? Was I using too many words, right? Or do I need to decrease the amount of words and make this process more simple for them, right? So those are things that we do as a team. And then the third one is the space. Is there enough light in here? Do we have enough seating options? Do we have the space that they need in order to be successful in what we need them to be? And this will differ depending on how you serve each individual. Have I built trust or connection? Is there someone in our team that this person can communicate, our client or the child can communicate well with, that they can tell the truth to, that they don't feel like they have to protect themselves with, but they can be open and honest because they have trust and they've built a connection. You probably want this person that builds that trust and the connection doing a lot of the face-to-face contact with your clients or with the kids. And then 5, being able to look behind the child or the family's behavior, right? Not only saying, oh, they don't want to be part of this program. They don't want to learn. They don't even want help. I think we should just, forget about them. But being able to look and see, what is the need? What are they trying to express with their behavior? What's going on? Was there a change recently in the family that has made this hard for them? This program hard for them, or this educational service hard for them? I'm reminded as I go through these questions of a maternity center that I helped. I did a little bit of consultation with them, and they called me because their biggest question is, we have moms that we serve and they don't know how to correct their kids. Like, they are in our lobby and the moms are waiting for our services. The kids get frustrated and they cry, and the moms don't know what to do. The moms also get frustrated. So we want to know how to help the kids. And I love this maternity center. I loved working with them. They took some of my training, and then we went step by step how to help. And I encourage them that instead of first thinking of the child, right, and maybe adding some more toys, we did talk about all that, but I encourage them to first think about the mother. Why can't the mother respond to her child's needs? Does the mother have her physical needs met? Just like we have maybe a snack for the child, did we offer the mom a snack? Did we offer her something to drink? Did she just come out of a long bus ride and she needs to sit for a while in a cool room to kind of relax? Does the mother have options in the space for the child? And I encourage them to put up options for the mother to give the child. A simple sign that says, if your child is crying, offer a snack, offer to play with them, sit in the reading corner with them. Just options, making the space more safe for them. I also asked them to think about, what is the first thing the team does when mom comes in to check in? How does the team look at mom when she can't comfort her child? Does the team glance at her? Do they try to correct mom? I really encourage them to first serve the mom, meet the mom's needs in order for the mom to be able to meet the baby's needs. And it's kind of out of the box thinking, right? We're used to thinking about the child and we want to help them, but we have to think about all the people that are in our program and how this trickles down to them. I'm going to go quickly through some of the slides. I want to have some time for some Q&A. So these slides, these next slides, is what you're going to receive in PDF form, and these are the things that you can discuss with your team, maybe as you're looking at your classroom, or even the way that you hold parent-teacher conferences, or the way that you send a child to the principal's office. What is the space? What is that procedure? What is that process? And how could we change it so that the person feels more safe? Okay, so this is what you'll be receiving in PDF form. I just wanted to show you that really quick. So let's finish up here by just thinking of those frustrating behaviors that we don't understand sometimes, right? And we started off by thinking of the lens that we view families, our clients, children that have experienced trauma, even our team and our coworkers, right? We need to change the question from what's wrong with you to what happened to you. We need to dig deeper. We need to say, what is the need and how can I meet that need? So here's the last thing I want you to do. Think about just a few things that you learned today. I think we went through a lot and we went really quickly. But if you would, in your chat box, share with all the participants, share with us, how have your lenses changed? What was that one aha moment that you're like, I never saw it that way, or I didn't know that, and this is now going to change how I interact with my students or my clients or the families that I serve. I just want to end with that, with just, a few moments of you being able to reflect, how has this changed my thinking? Or maybe you've been reminded of something. For those of us in this work that already know about trauma-informed care and we hear about it all the time, many times sitting through something like this really reminds us of something that we hadn't put into practice or hadn't thought of in a while. So type that in your chat box so that we can all see the things that you've learned today. And I'm going to hand it over to Jennifer now, and she's going to probably guide us through some Q&A here.
Thank you so much, Anna. And I think I'm speaking for everyone in saying thank you for such an engaging and authentic bit of expertise on this topic. For those people that were new, I know they got such a good sort of introduction to the topic. And even for those of us who have been in this work for a little while, as you said, it's such a good reminder in our professional and personal lives, the way we need to apply these principles. And I think it's never really been more important with everything happening with COVID-19. I think there really is some new awareness from some new systems and some new stakeholders about what families are going through, what children are going through, and what we can all do to better be ready to receive them and provide services in a way that's appropriate and healing. I wanted to just also mention, I know in our own talking about trauma-informed care practices, one of the things I love about it is that it helps everyone. So traumatized child or not, when you incorporate these practices into your services, into your organization, everyone benefits, whether they have a trauma history or not. I wanted to encourage everyone, if you have questions, we have a few minutes here at the end to put them in the Q&A box for Anna, and she could sort of be looking through them as I'm offering some closing thoughts. For those of you who want to continue to engage on this topic and hear from Anna some more, and I know I do, we have 2 deeper dives scheduled. So I know she mentioned a couple times, like, I wish I could deep dive into this. and she'll have that chance. So on September 3rd, she's going to join us again to talk about why can't I stay calm, understanding parent stress. And I will be signing up for that one. So excited about it. And then on September 17th, she'll come back to talk about why can't my child stay calm, and really do a deep dive into that regulation piece and the trauma-informed care strategies and principles that can sort of guide our work with a child who's struggling to regulate. So super excited about those things. I'd also point y'all, if you're new to ACEs, Text Protects did a report last year called ACEs Uncovered that was quite a good summary of that research, as well as strategies around trauma-informed care and policies and practice that can move the needle forward for those impacted. One more housekeeping reminder, and then we'll move to questions, that you will get the webinar recording and slides, as well as the PDF set that Anna mentioned, as part of a follow-up email if you registered here. And we'll also have those things available on our website long-term. If you have peers and partners that you think would benefit from this information, we'd love it if you'd share it. Okay, Anna, it looks like a couple questions came through.
Yes, and I love, by the way, reading everyone's aha moment and how they've changed their lens. I love that. So let me go to the first one. It's, how do we help our clients of color feel safer when the world is not a safe place for them right now? That's a really good question. And I think we need to consider, first of all, our space. Is our space and our team, our people, are they safe right now? And sometimes it really is saying, I see you and I hear you and I know things are hard. Is there something that we're not doing here to make you feel safe? And if that needs to go out in the form of a survey, if that needs to go through one-on-one with whoever has the best relationship with that client, but don't just ignore it. It's okay to call out that elephant in the room and say, we want to make sure that we're creating the safest space for you. Please tell us how to do that. And as a Latina myself, I know that I appreciate when people say that and when they call it out, and I am able to voice my concern or give the option to not voice anything at all. But it's okay to get that collaboration from them at some point. Thank you for that question. We have, after meeting physical needs, can you share some ideas for helping tween teenagers feel more safe? Teenagers are like my soft spot because I've worked with them for so long. And here's the thing, so many people are scared of them. And I think if we just understood them a little bit better, we wouldn't be so scared. Here's what I'll say quickly. First, you should join the webinar on understanding regulation, because I'm going to talk about even teenagers, how to help them regulate. And that's going to be a big part, right? Getting them out of that fear brain. Second, what I would say with teenagers and tweens, we need a lot of collaboration with them. They need to have a lot of say in what's going on. So if we are planning a trip and you want to make them feel safe and you want them to collaborate, we need to do it together with them. If we are trying to plan our week for virtual learning and we want them to feel safe and we want their voice to be heard, we need to collaborate with them. Hey, let's talk about what your day is going to look like. Here are some options. What are you thinking? And the older they are, the more input that they'll need to have in that. Remember, the more control they feel like they have, the more safe they'll feel and be able to be cooperative with you. So that's a short answer, even though we can go very, very deeply into that. And then we have, where's my mouse? This one is kind of a long one. I've seen sit-through trainings and never change how they address the children. Okay, I'm just going to focus on that one part. Here's what I would ask myself if I was in a leadership role with a team that I wanted them to learn a new skill, like treating children differently, or learn a new skill like a trauma-informed practice, and they're not learning. I would ask myself, what do they need? What is their behavior telling me? Because their prefrontal cortex is not engaged and it hasn't been engaged for a while here. How can I engage that? How can I, here's how I like to say it, like use trauma-informed care on my team so they can have all their needs met, and then they can use trauma-informed care on the people that they serve. So that's a hard question, and I know it's not simple, but I would really ask myself, does my team feel safe? Do they have what they need? What is the meaning behind this behavior that I'm seeing? I think that's our last one.
Thank you. And I would just add to what you said, Anna. I know, for those that are newer to the trauma-informed care conversation, it's so important to know that this is not a one and done, check the box. Oh, I know what the strategies are now, got it, good to go. This is like all behavior change, kind of a very long ongoing process of reflection and learning and steps forward and sometimes steps back. And certainly even more so if it's dramatically different than our own experiences or if we have trauma ourselves. So it's a process.
And that could be part of like, what do they need? Do they need more coaching, right? Yeah, that's really good.
Yeah. Well, like a pro, Anna, you're just finishing up right on time. It is 12:58. And to all of you in the audience, we appreciate you so much spending your lunch hour with us today. I've learned so much. I hope you have learned so much. Thank you again, Anna, for the generosity in sharing your time and expertise, for being vulnerable with us and teaching us today. I really appreciate it. And to all of you, I hope you'll join us on September 3rd and September 17th. Stay connected with Text Protects and Fostering Hope. And we hope you have a wonderful afternoon and rest of your week.